TV. Innovative content, global audience.
Pain is more than just a feeling of discomfort. It can affect the way you feel overall. It may also lead to mental health conditions like depression and anxiety. Acute pain can happen suddenly, which can sometimes linger into hours, weeks, or days, but can be resolved if properly managed. The question today is, how can we manage pains, and at what point should we see a doctor? Well, I have a professional on pain management on this show this morning. She's pharmacist AKANDE, ROSELINE OLUWATOBI. This is our head, so we'll talk about your health, my health, and our health in general. I'm Princess Kessy, reaching you from live from our SROTV newsroom here in London, the world's capital city. Good morning, viewers, and good morning, ROSELINE. Okay, I think we're having, that's quite early. We have a little network issues with her. But today we're going to be discussing about pain management. Now, what is pain management? What is pain? How do people deal with pain? These are some of the questions we'll be asking today. At what point should you see your doctor? And do you keep taking painkillers on that particular pain? Or sometimes too, doctors might refer you to pain management um, therapy or whatever it is it's called, but sometimes you need to know how to manage pain. You need to know when to stop taking that painkiller. You need to know at what point you just go straight to your doctor, and what kind of painkiller you have to take to manage your pain or your crisis. Of course, we know that a lot of people, a lot of persons, for one reason or the other, might be in condition where the pains will be there for a period of time. Like I did say, pain can be something of minutes, hours, days, or weeks. Depends on what's actually happening to you. And then how can you manage the pain? What is even pain management? And how do we manage? At what point do you go and see your doctor, or at what point do you should you stop taking a certain painkiller? We live in a society where people tend to abuse drugs a lot. They just of course, no policy. How will I say it? They just go to the nearest pharmacist and they tell you, okay, I need a painkiller, I have headache, I have this. And funny enough, people in our society tend to take overdose sometimes. Yes, I've seen people do that. They tell you, okay, I think I'm having severe headache. I won't take 2 Panadol anymore, paracetamol. It won't work for me. So I have to take 4 to make it work faster and quicker. Is this even healthy? These are some of the issues we'll be looking at today. And thank God we have our pharmacist back on the show. Good morning. Good morning, ROSELINE.
Yeah, good morning.
Nice to have you with us this morning. You're welcome. Yes, so let's talk about pain. What is pain and what is pain management to a layman right now? Because people just feel pain is just, it could be anything, maybe headache, maybe you have a little sprain on your leg, or you have your tummy ache and all that. But what is pain and what is even pain management to a layman watching us?
Okay, so
hello, can you hear me? Okay, I think network is not very friendly this morning. Can you hear me? Your network is hanging, ROSELINE.
Yeah,
hello.
I can hear you, but yeah, I can hear you now.
All right, so tell us quickly, what is pain management?
Okay, so basically, I like to say that pain is, of course, something unpleasant that happen, like an unpleasant experience you have which could be as a result of a confirmed or potential tissue damage. And of course, I like to say that pain is more like a symptom that you experience for any preceding disease or for any injury you probably have. Because if you look at it, if you want to confirm you have like a cancer or something, I don't know if I can still be heard.
Yes, go ahead. We can hear you. Just that your network is very bad, but what can we do at this point?
Ooh, I'm so sorry about that.
Okay, go
So, and
ahead.
then pain management is just like the name says, it's managing pain the best way you can to manage.
Okay, I think it's going to be a very long morning with Rosalind this morning because her network is not very friendly. Like she was saying, pain management, is something that, it's when you feel a discomfort, that is where I put my own pain. Pain is something that is not very pleasant. We all know that when you start having that excruciating headache, even mild headache, your everything just changes about you. When you start having that tummy pain, you just tend to feel discomfort and you just feel withdrawn from people around. When you start having that even chronic pains, that is why we'll say that when something is happening to somebody, we don't even know how it feels because you're not in their shoes. It's when you start having a kind of pain that you know that, okay, this is something that is really, really bad. And I want to talk about pain management, like she was saying. Of course, I'm not a professional, but she's a professional. Pain management is an aspect of medicine and healthcare involving relief of pain in various dimensions, from accurate and simple to chronic and challenging pains. Now, this means that you have to, when the pain could be mild, it could be chronic, it could be acute pain. But at the end of the day, how do you manage these pains? Now we have the ways to manage. Of course, she's going to come and tell us how to manage pains. I do hope she will resolve our network issues and join us really quickly. And then we have pain. We have pain medicine, the painkiller, and that is why people resort to self medication. A lot of people over the time, like I did said earlier, people tend to do our people we are used to it as like Nigeria, for instance, where I'm from, we're used to that, where people just go to the nearest pharmacist and they tell you they prescribe for you the pharmacist. That is what we're used to. It's not even healthy. A lot of people will come and prescribe to you for pharmacist or the doctor. No, 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 this is what I want. This will work faster, quicker, and I don't want anything that way. And the worst of it all is when a medication that is supposed to last, the duration is supposed to be maybe for 8 hours. Maybe doctors say you have to take this 8 o'clock in the morning, and you take another one maybe 2 in the afternoon or in the evening. You see people just taking 8 o'clock in the morning, and by 11 they tell you, oh, the pain is back, I can't bear this pain, I have to take another one really quickly. Now, is that even healthy enough? Okay, we have her back. I really do hope that network will allow you this time. Hello, can you hear me now, Roseline? Okay, apparently I'm going to do the show myself today because Rosemary cannot hear us, Roseline rather. So people tend to just like, okay, I want this, I want to take more than what the doctor asked me to take. That might relieve the pains. But the issue is, how long will you keep taking that medication? Because I've interviewed a pharmacist before and a doctor that said once that medicine it's for 8 hours, even if you take another one, it won't be effective because that one is still working. And because you feel the pain more than the time you took the medicine doesn't mean that it's not working. These are tissues or something. When you take medicine, it tends to relax, and after a while you start feeling the pain, but it doesn't mean that necessarily that first one is not working. And is it even good for your health? Let's talk about your our organs. When you take overdose of medication, when you keep abusing a particular painkiller, some might be mild. We have painkillers that are very mild. We have painkillers that are very harsh as well, very strong. I'll talk about paracetamol. These are mild ones, but I don't even know how healthy it is for somebody. Like I said, I know somebody that was feeling headache and he resorted to taking four at once. Even sometimes when I'm having after work, I have a severe headache. People used to tell me take four so that you just go to bed. Like no, the dosage is two, and I'm taking two. Now, when we talk about pain management, we have key pain management strategies includes. Now, one of them, when we talk about the management, how to manage pain, we'll talk about pain medicine. That is the painkillers I'm talking about. You talk about pain medicine. We'll have I don't know the name. There's a particular name for it. Doctors can to prescribe, or we'll talk about the normal Panadol, paracetamol. Of course, when the pain is severe, that is when you have to cross to those very ibuprofen, diclofenac. Those ones are for very, very accurate and chronic pains, not mild pains. And that is some way. I can't say she's a professional. She'll have to tell us that. But on this show today, we look at the type of pain. These are the questions I wanted to ask her: the type of pain and what type of pain this kind of painkiller, or what type of pain you say, okay, this type is not what I'll be able to manage at home or from a pharmacist or a chemist shop around. I have to see a doctor. What causes the pain? These are some of the things we should look at. What actually causes the pain? Is this something that when we talk about pain management, sometimes you have to go to the root cause of what actually is the cause of that pain? Because if you don't treat the root cause, so you might just be treating, for instance, you're having toothache. If you're having a toothache, okay, it comes and go, you know how painful toothache can actually be. And then you just have to come and keep taking a painkiller, a certain painkiller. Of course, toothache is a very very, very strong, it's the pain is usually excruciating. Everybody knows that. And then when you now come and say, okay, I'll keep taking medication, painkiller, ibuprofen or diclofenac to calm the pain. Now, why not resort to having go to the root cause of that pain? Maybe that will help you overcome the pain. When you go to the root cause of a particular pain you're having, for instance, I say toothache, not just taking a particular painkiller just to dial the pain off, and then the next 3 days you're under pain, you go back to that painkiller. No, sometimes you have to go deep into the root cause. You treat it from there, and then that just helps you to stay off the painkiller, because sometimes this painkiller cannot even when you tend to take them too much, I think they have side effects as well. These are some of the things I wanted to ask our very pharmacist. I don't know if a network is actually okay now, but let's see if we can bring her back on the show now to join us. I can see her here with us, but hello, good morning. Is your network okay now?
Yes, it is. I switched my network already.
Okay,
Yes,
so
I switched my network
quickly,
already.
we were talking about pain management.
Yes. Okay, so I was basically saying that for pain management, I think a lot of people probably think that pain management is just taking medication for pain, but then it's way beyond that.
That is
It's
what
not
I
only
think
about taking
myself.
med. It's not only about taking medication. Of course, there are other measures people use to manage pain. More like there's this psychological method, there's other exercise and all of that. It's not every time you should just you feel pain, you just go pop medications and start taking. These in turns have like side effects, of course, yeah. Because when you overtake them, they have side effects. Now, one thing I like telling people is every medication is a poison, so you don't overuse them. But when
Use
you
it.
use them in the right proportion, it's not going to give you
Rosalie,
any harm.
can we drop your phone? You're holding your phone, right?
Yes, I am.
There's no place you can drop the phone?
Um, I'm not sure it's going to be well stationed, but I'm going to try to do that right now. Okay. Um,
Yes, you should just sit back a little. That is fine because we've used most of the time. We need to do this quickly.
okay.
Yes, it's much
I'm
better.
going to start. Ooh, okay. I think, is it better like this?
Yes, let's just go this way. That is perfect.
Okay.
Yes, so when we talk about pain management, now you were just explaining that it's beyond taking medication for a certain pain or pain, body pain. It's beyond, way beyond that. Now, what are the types of pain? Let's even start from there. What kind of pain will warrant just taking medication, or what kind of pain warrants doing way above beyond taking medications?
Okay. Basically, ideally, pain is categorized into two. There's chronic and there's acute pain. Most acute pain, well, it doesn't mean that you won't take medication. Of course, for instance, stomach ache is acute pain. It doesn't really last for a long time. Chronic pains are those that last for 6 months and above. So, and okay, for instance, you have stomach ache. Of course, instantly you need something to relieve
To
you.
relieve the
You
pain.
won't say, "Oh, I need to do exercise or something." No, but there are some pains like let's say you have a leg issue or a neck pain. You might need to do some little neck exercise, to go about. And then for instance, you have like a fracture in your leg. You see, that's where they come about this therapy stuff where you have to meet and then they start exercising your leg like little. Even as you are taking medication, you are also doing something to make your bones stronger. So you engage in exercise, and that's where you
Wow.
have the physiotherapists come in to assist in that aspect.
Okay, now we live in a country where people tend to abuse medications. You talk about painkillers. People are not used
Yeah.
to prescribing for themselves. You even hear, at least you're a pharmacist, you should be used. Your phone is not very well positioned, Roseline.
Okay, is it better now?
Yes, just leave it that way. Please, let's do this quickly because we don't have
Okay.
much time. Okay, so we live in a country where a lot of people tend to abuse medication. They just tell you, "Oh no, doctor, don't give me that. Oh, this is what I want." And once you tell them, take a two, maybe two tablets for 8 o'clock, maybe around 8 o'clock, another two in the evening. Can you hear me, Rosalind?
Yes, I can hear you
Yes,
perfectly
now they
fine.
tell you, and you try to prescribe, and they tell you no, that it will not be strong enough. I need something stronger, or I will take away above two just to calm the pain. And what do we do in a situation like this? We see that a lot. Is that part? Would you say these people also are? Which they should be placed under, pain management class or whatever, because I know that when people are in severe pains, you might want to take a medication around 8 a.m. You're supposed to take another one around 2. And around 11, the pains come back and they tell you, no, I can't wait till 2. I want to take another one. They keep taking to bring down the pain. How dangerous is this?
Okay, so of course, I am currently in Nigeria, and that is one of the major things we face. People come, and a lot of people love self medication, and it's not like a good practice anyway. So, and this pain relief when you overuse them. I'm going to repeat saying that because they are. So I've had people walk into the pharmacy where I work. I'm like, give me this. And they mention different classes of pain medication and they want to use it for just one thing because they feel pain. And then I'm like, I take my time, like, okay, what do you want to use this drug for? I start to engage them. And I feel that I think if every health worker start engaging people, we'll see a lot of errors that people have been doing, maybe due to ignorance or maybe because they have no idea that they are harming themselves when they take these medications like that. So what I basically do is I ask them what kind of pain they are experiencing, because I feel that you need to know what you want to solve for you to get a perfect pain relief to use. If I understand what is causing your pain, I'll tell you the best medication for you to use. So let's say, for instance, someone walks in with, I want to get paracetamol, I'm having banging headache, I'm having this. The first thing is, I don't just give them, of course, I'm supposed to give them paracetamol for their headaches, but sometimes I don't just give it to them. I ask them, what is the nature of your work? How have you been coping with stress? You know, sometimes stress can just make you have this headache. It's not because
Yes.
something wrong is happening to you. So, and sometimes some of these things don't really require medication. You just need simple rest. When you go to bed and rest, you might be overstressing yourself. So when you take your time to rest, you find out that all you needed was rest, not medication. So I asked them, have you rested enough? Have you had enough sleep? How was your work? You need to take time to rest before you start taking medication. And most times, some of these patients that, listen to what I have to tell them, they come back, I'm like, oh, did you know that I didn't even bother to take medication? I just slept and I woke up perfectly fine. So I tell them, and some people, another thing I need you to know is, if you want to take medication, you need to be sure you don't have ulcer, because
Okay.
that has put a lot of people in danger. That has
Okay.
put a lot of people in danger. You probably don't even know if the person is an ulcer patient, and then you give them NSAIDs, drugs that will trigger their ulcer again. You will think you're doing them good, but at the end of the day, they see themselves in the hospital because something has gone wrong just from the simple medication you give them without asking them questions. So sometimes I tell people when they come, I'm like, please, this drug, as tiny as it is a poison. If you use more than I tell you to take, you might end up seeing yourself in the hospital. I find that some people, if you don't tell them the danger, they might not really listen to you. But when you tell them the danger that is involved in taking overdose, they tend to like follow your instructions. And that is what I started doing. Please don't take more than two. And I tell them, if you take two now, if it's not yet time for you to take another one, no matter how much you're feeling pain, please don't take excess. Because some people will tell you, if I take 1,000 milligram of paracetamol, it doesn't work for me. I need to take 4. And I'm like, you're killing yourself. You're suffering your liver. Your liver is going to have like, it's going to suffer from whatever you're doing now. You might not see the effect now, but later on, this thing is a gradual process. And at that point, it might be too late. And you will have to start spending your fortune trying to go through a lot of surgeries and all of that. So when I make people understand all this, they try to I have people that even before they take paracetamol, they have to call me, ma, fam, please, I'm going through this. Is it safe for me to take paracetamol? I'm like, that is fine. You need to know, you need to be very close to your healthcare professionals before you take any medication.
Wow. You did talk about some of the dangers of taking excess of this medication. I want you to throw more light on that. What are some of these dangers that are prone to health when you take excess medication, when you keep taking medications or painkillers you're not supposed to be taking? Because you said also
Actually,
that sometimes you just need to rest, you just need to stay hydrated, rest, and then you will be fine. But when people keep taking medication, feeling okay, I just want to stay off the pain and all that. Or sometimes when, like you did say that, you tell them take 2 tablets for this matter, this specific time, and they tell you no, it won't work. They have to take a double or thrice of that number. Now, what are some of the dangers? I want you to lay them down carefully for viewers to hear us.
okay, one of the major danger with overdosing yourself with painkillers is because the major thing for all of them is they affect your liver. They affect your liver badly, and that is not something you want to happen to you. Another thing is, I don't want to use the word resistant, but I might have to use it here. You will be resistant, and that's why you see some people will tell you, paracetamol doesn't work for me again. Why? They've used it even when they need it and when they don't need it. And at that point, your body gets used to that medication, and when you take them, it might not work for you again. And then the doctor might now have to start thinking of placing you on an higher level compared to what you were supposed to be taking. And
Okay, your
is you are
body, your body now become resistant to it when you
resistant to,
use
yeah, that's the
it.
same thing that works with antibiotics as well. The body
Okay.
become resistant, and then you have to start fighting for your life and looking for the best drug option that will work for you. And that's not something I think I want anybody to experience.
Now, how can we manage pain without medicine? Is there any way? You did say that there are some things you do like sleep, other things, exercise. I want you to lay them down carefully. What can we do when we have pain? How do we manage pain properly without sometimes without even medication?
Okay, so basically, first of all, you need to know what is causing your pain. For instance, if you have a leg pain, you need to be sure, okay, I have a leg pain. Do I need to take drug instantly, or do I need to just stretch my leg? So, first of all, you need to understand what is causing your pain. When you understand what is causing your pain, you know the best way to go about it. If I'm having a leg pain right now, I don't rush to go and take painkiller. I just like, okay, my leg is paining me. Let me stretch my leg. Do I need to use cold compress? Do I need to use hot compress? Do you understand? So if it's okay, for instance, now stomach ache, we know that okay, that one you need to take medication for that. But then I need to know what is causing my stomach ache. Is it because I've not been able to use the restroom, or is it an ulcer pain? So if I understand what is causing my pain, if I'm having a bloated tummy and I've not been able to use the restroom, I need to look for something that will help me. So it's not necessarily a pain relief. You need to get something that will help me release whatever is in my bowel so that I am feeling comfortable in my stomach. So that's the boils down to. You need to understand what is causing your pain to to know how best to manage your pain. And of course, you can always reach out to any healthcare professional to help you. If it's that you need to rest, if you feel like, oh, you've been overstressing yourself for a very long time. And then I think staying hydrated is underrated. Let me put it that way. A lot of people don't know that when you stay hydrated, you will solve most of the problems you face actually.
Wow. Now, you did talk about that sometimes you don't necessarily need medication for some pain, you just need other exercise. But managing pain that cannot be easily relieved, how do we manage? You talked about pain that could last up to 6 months, 3 months.
Yeah.
We go about this, knowing fully well that this painkiller we take, they're poison as well, so you don't abuse them now. But what of people who have to stay maybe 6 months, a year to manage a particular pain?
Okay, so for those ones, the truth is they have to keep taking it accordingly. The way drug works is when they give you every drug have a shelf life. Yeah. So if they're giving you a drug to take, or take one 12 hourly, so one in the morning, one in the evening. Now the reason they are saying that is because the first dose you take can last you through those 12 hours. So once
Hours.
it's approaching once it's approaching the 12th hour, the power it's reducing, and then you're taking the next dose to boost it up again. Yeah.
Okay.
So that's why. So but if you are abusing it, that's when the problem comes. Instead of you to take it twice and you're taking it 3 times, you are overdosing yourself. But when you take it accordingly, it doesn't have any effect on you. Take an instance for people that are going through surgeries, there's some chronic pains. They give it to them in the hospital. Not, of course, they give it to them because they know they need it. When you're taking something because you need it, it doesn't harm you. If I'm feeling so hungry, I don't have to keep starving myself. I need to take food. But if I'm full, and then I'm forcing myself to take food, that's me abusing myself. I don't need the food at that point. Why am I trying to feed myself? So that's the same thing with medication. If you take food when you need it, it helps your body. If you take medication when you need it, it helps your body. It helps you solve the problem. Same with food. Food will stop. It will solve the problem of me starving and getting hungry. When I eat the food, I'm filled up. Same thing with medication as well. If I overtake medication, I see the bad effect of it, and that's why I'm like, okay, this boils down to you have to listen to the instruction of your pharmacist, your doctor, your nurses.
Now, fam, let's talk about choosing the right medicine for pain, or pain medicine or painkiller. We live in a society where I want to believe you're used to people prescribing for themselves in front of you, a pharmacist, a layman coming to tell you, no, I don't want that. This one is more effective. No, 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 that will not work. Or I won't take it that way. I'll do it my own way. Now, how do we choose the right pain medicine for each pain? How do people start identifying that, okay, I have a mild tummy pain, I have headache, it's not very excruciating. What are they supposed to take? Because you see people having mild headache, and the next thing they are going to take ibuprofen, take diclofenac, take a lot of strong medicine that they are not supposed to be taking. How can people
Okay,
choose the right
so
medicine? Especially talking about mild pains,
first,
managing just little pains.
okay, so first of all, I'll say kudos to pharmaceutical companies because they've helped us in a way that one particular drug can treat some certain pain.
Okay.
Take for instance, paracetamol, for instance, can work for headache, it can work for mild stomach pain, it can work for menstrual pain, and all of that. Yeah. So you don't need to start, and that's what most people don't know. So they feel they need to get different categories of painkiller to solve different problems. That's why you will see somebody come to say, "Give me paracetamol, give me ibuprofen, give me diclofenac." They want to take everything at once. And I'm like, see, once I see people asking those for those medication, the first thing is, what do you want to use it for? I'll tell them, I'm sorry, but can I ask you a question? What do you want to use it for? And then when they tell me, I'll tell them, you actually don't need all these drugs. You need just one. One
One.
is enough to solve all the problems. But if they don't know, of course, they would think each of them have different purposes. And that's why I said kudos to pharmaceutical companies for having this combination of drugs that can help. Like for instance, there are people that tell you, "Oh, I'm having difficulty in sleeping. I feel pain at night. I feel this." Of course, now there are medications that handles both of them, that makes you sleep and then also relieve you of that pain. Instead of buying different medication and bombarding yourself with different pills at once. So what the best way to manage those kind of thing is engage them. It might be a bit tricky and difficult as some people don't like to open up. Yeah, some people don't like to talk. But once I see them, I know there are some people that, let's be sincere, even if you tell them, they will still tell you they want to get it. They will still tell you they want to get it. So what I eventually do is, as they are insisting that they want to get it, I keep telling them the bad effect of using all these drugs together. Because I want to believe that even apart from having just ulcer, taking all of this can even make you develop ulcer because you are destroying your stomach walls. These drugs are acidic. Let me put it that way. They are poisonous. So you are causing it. So I just say to them whether they listen to me or not. And sometimes I've had to tell people I can't sell to you. I've had to tell them that, and they'll be like, you have to sell this to me. I'm like, no, this is an oath I took. Save life and not to kill. Because if I give it to you, if something happens at the end of the day and they ask, who was the pharmacist that attended to you? It comes back to me. They will be like, don't you know what you are supposed to do? Is the patient supposed to rule over you or tell you the best way to go about it? So there are times I tell people, I'm not selling this to you because you don't need it. Some of them will eventually listen, and some of them will get angry and leave the pharmacy. But I feel this satisfaction that I've been able to save this patient. I feel that when they get back home, they might have to rethink about it. And of course, some of them might be.
Okay, we have a little bit of network issues there coming from Roseline's end, but she's really making a good point why you shouldn't take some of this medication or why you should not even think of abusing medications. Sometimes I said it earlier on my show that you tend to take overdose of this medication, this painkiller, every drug. There's something I want to take from the show today. Something she said that every drug, every medication is actually a poison, so you don't need to abuse it. The fact that you're taking a medicine for a specific pain or a particular pain is bad enough. So you don't necessarily need to add more, keep taking overdose or just keep taking, you're there, you know that this duration is for 8 hours or maybe 10 hours, and you keep taking uh every 3 hours. No, all this boils down to your organs, like what she rightly said. All this boils down to your organ, to your liver, to be precise, and at the end of the day you start running head to scatters. I need this, I need that. But at the end of the day, there is a way also you can, like she said, you need to know the root cause. And another thing I wanted to ask her is, I blame this on maybe the pharmaceutical companies, because sometimes some medicine should not be easily accessed. When you know that this painkiller is too strong, they should always be a prescription. But we live in a society where they don't prescribe drugs. They just tell you, they go and the patient start prescribing for you, a pharmacist that is supposed to be doing the prescription. And you see that you just go to any nearest pharmacy nearby and you can get anything you want to get, and you start taking. And I wanted to even ask her as well, there are some norm that comes with medicine, painkillers. People sometimes don't even eat well. This is something I want us to talk about today. When you're saying you're managing pain as well, and you don't eat well, and you keep taking painkiller, is that a disadvantage? Is that an advantage? Or is that something that is even hurting you even more? And sometimes also, people don't tend to take enough water. I wanted to even ask her about that. When you take a particular medicine, painkiller, drinking more water with it, is it going to work faster, relieve your pain faster? These are all the issues we're talking about here today. Talking about how to relieve you of that pain, of that stress. Now, no matter what you're going through, sometimes, like the pharmacist rightly said, it could be a stress. You work, you don't sleep on time. For instance, me, I don't sleep well sometimes. I don't sleep on time as well, because I'm either writing the next script for script for the next day. I'm researching. Like today, I'm not a doctor. I'm not a health specialist, but here I am talking about pain management. That is because I was able to research a little on it. So when people are sleeping, I'm busy researching. I'm doing something. And I wake up very early as well, start preparing. This could actually lead to some kind of pain, tiredness, anxiety, stress, and headache. And you just feel, oh, I'm seeing, okay, this pain is too much. I want to go and take a very powerful painkiller just to knock myself out. No, it doesn't work that way. You have to take time out to rest. Like she said, drinking water a lot. You have to stay hydrated. Sometimes this helps you to even stay off medications and save your money as well. Because if you don't do that, you keep wasting money on a particular thing. At the end of the day, you see that, okay, Roseline, I was going to ask you, when we talk about, there are some norms that comes with taking painkillers or medicine. Now, you're a pharmacist. What is this thing make believe, or the cliche that if you are taking a medicine, you don't eat well, but you keep taking medicine, will the medicine work for you or against you? This is what I want you to tell us today.
That's if you're taking any medicine at all.
Yes, and especially this painkiller. You see, people tell you they have trying to manage pain, especially in the office. I'm having headache. They've not eaten since morning. It might be hunger, but they tell you no, it's not just headache, and they take painkillers without meal. Now, is this what can you tell us about this?
Well, personally, I always advise my patients to eat food before they take any painkiller, just to be on the safer side, so that there is something coating your stomach walls, so that this painkiller doesn't affect you or cause ulcer. That's the same thing. It's just like how for ulcer, it's more like you have a tear, you have a wound in your stomach walls, and that's why if they take a painkiller, the painkiller tends to, it's more like an acid. It's just like pouring an acid in an open wound, and then it causes more pain. So I always advise people to eat food before taking any painkiller. And please, always take your medications with water. No alcohol, no drinks or any stuff.
I was
Just
going to come to that actually. Thank God you brought that, because there's this make believe that you must, anything you use, if it's liquid, it will go. Sometimes if you use alcohol, it makes it work faster. I've seen guys they've been doing that over the years, and they tell you, oh, it will make you work faster, or you can use milk, you can use maybe a soft drink. A liquid is a liquid. Thank God you have to even clarify this.
No, no, no. A liquid is not a liquid. Actually, there are some medications that they will specifically write it on your body. Don't take this with this. For instance, antibiotics now, ciprofloxacin. Don't take it with milk because it reduces the effect of the drug. Anti-malarials, don't take it with juice that has fruit and all of that because it will reduce the effect of the drug. Same thing with every other drug. Is the best way to take them is to take them with water. That's to be on the safer side, please.
Now, what is this belief as well that if you were taking a painkiller and you drink more, after taking it, you have to drink a lot of water, it will make it work faster. And if you take a painkiller without taking enough water, it will work effectively. How correct is this?
Okay, so basically, it's not only for painkillers, it's for all medications. You need
Okay.
to take enough water so that it helps with absorption, it helps with all this, it helps with absorption of the drug. It's for all drugs, not just painkillers.
Okay. Can you hear me, Rosalind?
Yes, I can hear you. I'm saying that this rules applies to all medications, not just painkillers. You need to drink water before and after taking your medication.
Okay, now there's this also this belief that when you want to take a medicine and it falls on the ground, no matter how clean the place is, you shouldn't pick it up. How correct is this?
Did you hear what I said? I said this applies to all medications. You need to take
Can you hear me
enough
now,
water when
Rosie?
taking any
Yes.
medication.
Okay, can you hear me now? Hello. Can you hear me?
Yes, I can hear you.
Okay, now I'm asking you another question, right? There is this belief that when you're
Okay.
taking a medication and it falls on the ground, now no matter how clean the surface is or the place is, you shouldn't pick it up to take it. How correct is this?
This is very correct because you're taking it into your body. Even if you feel that your surface is clean, if you have to use microscope to see what is on that table.
Oh, I was having a very interesting conversation there, and this network issue again. Because these are some of the things we need to know, especially managing pain, taking painkillers here and there. You see that there's a lot of belief when it comes to medicine, and you hear a lot of things. So I needed to clarify this from our pharmacists. They are the people, they are the professionals, so she should be able to tell us. And I love the fact that she said that no matter how clean you think the surface is, because it's you take it into your body inside, you shouldn't take it again. Now, these are some of the things. Now, I wanted to ask her, when you talk about managing pain, when somebody takes a particular medicine and they tell you, okay, I'm strong enough, I'm not supposed to complete the dosage. Now, how dangerous can this be? There are a lot of things I want to speak to her today, but because of time, I will even let her go back to work. I know they are dragging her. She's attending to a lot of persons there. I can see from here that she's actually attending to a lot of persons where she's working. People are in pains. She needs to attend to them, and it's good that they are going to meet the pharmacist, not abusing drugs or self-medicating. This is one of the problem we have when we talk about medicine, the way people self-medicate, the way they take the what they take for what is they are not supposed to take it for. Like what she said, for instance, when you see Procode is meant for cold, is meant for headache, is meant for nausea, and then somebody still take Procode and take another painkiller. No, you can't do that. That is a drug abuse. And that's all she has been telling us today. I even wanted to ask her a very serious question, but maybe next time we'll have her on the show. I can talk to her about that. Roseline, just before we let you go, hello, can you hear me? Okay,
Yes, I
she's
can hear
very busy,
you.
she's a very busy pharmacist, and you can see she's busy attending to people in need and in pains. Well done. I can see from here all you're doing there.
Thank you.
Yes, so I was going to ask you as well. Now, I want to talk about medicine. There's this thing that used to come with a pack when we buy it, and there's this debate about it. They will tell you before or after meal. I don't know whether you know what I'm talking about. There's something you put the medicine, a little bag, that little bag from the hospital or from the pharmacist, you will see take before or after meal. Does that mean that we can actually take a tablet before eating, or we'll have to wait after eating before we take it? I want you to clarify this.
Does that mean what?
Does that mean that you can take a medicine before you eat, or you have to eat before you take medicine? Because when you go to the pharmacist or the hospital, sometimes you will see on the pack of the medication, they will tell you take before or after meal.
Yes, yes. Okay, actually, there are some medications that actually you have to take them without meal. You have to
Okay.
take. Can you hear me?
Yes, go ahead.
Okay. For instance, like I mentioned earlier that if you want to take pain relief, you have to take them with food. That means you must have eaten before you take those medications. Now, for some ulcer drugs, more like I'll give an instance, omeprazole, it has to be taken on an empty stomach. So that one, they will tell you, please don't eat before you take it. If peradventure you've eaten, wait an hour after you've eaten before you take this medication, because they believe that at 1 hour after you've eaten, your food might have digested a bit and all of that. So your stomach is almost empty again. So there are medications like that, and that's why I said you have to listen to the instruction they give to you.
Now, how many
If they tell
minutes
you to take
can we wait?
medication with food,
Okay, how many minutes can we wait after a meal to take any medication?
okay. So I'm saying that how many what?
How many minutes do you have to wait to take a medication after a meal? Hello.
Okay, so can you hear me?
Yes. Is it after, like I'm asking you now, you're supposed to take, you say some of these painkiller we should take after meal, we should eat very well. Now I'm asking you, is it immediately after eating, or you have to wait like 5 minutes, 10 minutes before taking it?
Actually, you can take it immediately and you can take it in between meal as far as there's something in your stomach already. It's
Okay.
majorly for those drugs that they tell you taking on an empty stomach. Those are the ones you have to wait in case you've eaten. You have to wait like an hour, 30 minutes, thereabouts before you take those medications. And that's why I said you need to follow the instructions they give to you for you to really enjoy the benefit of those drugs.
All right, just before we let you go, Roseline. So when we talk about pain management, you did talk about okay, we have to even let her go already. I wanted to ask her to be just specify some of the medicines we can take for mild pains instead of people taking very harsh medicines. This could really endanger their lives. Rosalind, just before we let you go, when we have headache, mild headache, tummy pain, what can we take? Okay, network won't allow us do that. And hopefully next time we'll have her on the show's viewers. Thank you so much for being on the show with us today. It's been a very educative one, if you ask me. I never knew that when we talk about pain management, I just thought it's something that when you have to manage your pain, you just go and buy one painkiller, you take, and you're okay. No, it's way above that. Sometimes you don't actually need medications to resolve that issue. Sometimes you just need a therapy. Sometimes you just need exercises. Sometimes you just need rest to manage a certain pain. It's not necessarily about taking medications all the time. So because of your organs, because of your liver, you watch what you take. And if there's somehow you can, maybe you're having headaches, so it's not always you take medication. Sometimes you just have to rest it out. Sometimes you just have to have a good sleep, drink water, and then you will be fine. You don't necessarily need to keep taking medications all the time. You can manage pain without medicine. That is the message today. You only have to go and take medicine when it's beyond. Okay. I really do hope your network will allow you to give us your last words. At what point should someone see a doctor when they have pains, Roseline? At what point should you say, okay, this is beyond you taking medicine, buying for yourself, go and see a doctor? Can you hear me, Roseline?
Yes, I can hear you now.
At what point should you see a doctor? We'll talk about pain management. When you keep managing and the pain keeps coming, at what point should you, a pharmacist, or refer them to a doctor?
Okay, so basically, once they've taken and managed themselves, they've done the home therapy they can, and then it's not reducing, you might need to go see. I tell them to go see a doctor so that we probably might know what exactly is causing. If they have to go through a series of tests or something, because you don't have to keep managing. It's just like managing a car.
Okay, that will be all today, viewers. Network is not very friendly with Roseline today, so we have to let her go. And before I let you go, don't forget that your health is your wealth. And your health is the only place, your body is the only place you have to live in. So you have to take care of yourself very well. And you have to stay hydrated. We cannot, this is even when people say, I don't like, you need to drink water in between meals. Just make sure you are hydrated. That will help flush your system. That will help you stay healthy as well. It's not all the time you run to a doctor, you run to a pharmacist. I need this, I need that. There are some things you could do on your own and you stay healthy. Eat healthy. Now, I'm going to leave you with these tips for today. Eat healthy, regular meals, and eat healthy regular meals. Make sure you eat healthy, not just eating. That is another problem we're having today. You see, all these ailments will have sicknesses here and there. Is all we consume, is all we take in. So you need to eat healthy. That is one of the things I'm leaving you with today. Eat healthy, regular meals, and stay hydrated. A balanced diet and plenty of water can improve your energy and focus throughout the day. So this is the reason you should eat healthy. I know that a balanced diet and plenty of water can improve your energy and your focus, your mental health or mind for the day. So please try to know what you take in. Watch what you eat, not just because you want to eat or somebody is eating it and you just want to eat. No, eat at the right time. Sometimes people skip meals. You don't have breakfast, and before you know, you're stressed, you're working, you're tense, you start having a headache, you think you're sick. No, you're not. You just need to eat well, rest well as well. Don't forget to rest well. This is why I will leave you today. And remember, your health is your wealth. So take care of your health until I see you again next week. Thanks for being on the show, and thanks to our pharmacist, AKANDE ROSELINE OLUWATOBI. Although her network was quite very tricky today, but at least we learned something from her as well. And before we go, don't forget to hit on the notification bell. Follow us on our social media handles, Facebook, Instagram, Twitter, and YouTube. Leave us with your comments. We'd love to hear from you. And I leave you with these words as well. Remember that peace is priceless. So whatever you do around you, everywhere you go, let's give peace a chance. I'll see you again next time. I remain yours truly, Princess Kessy. Bye for now.
SR TV.